My name is Sheena Rosam Lazo from Davao Doctors College, your student nurse for today. And now, I'm going to perform a return demonstration about wound care. Wound care consists of thorough cleansing, irrigation, and debridement of contaminant-impregnated tissue. The importance of wound care, especially in nursing, relates to the ability to reduce a patient's pain and promotes healing. But before we proceed to the step 1, we must introduce yourself to the patient to establish rapport. Good morning, sir. My name is Sheena Rosam Lazo from Davao Doctors College, your student nurse for today. And now, mag-wound care po tayo. So, ako po yung naka-assign sa inyo para mag-wound care. Step 1. Identifying patients using two identifiers. These are the name, birthday, or medical ID number in the patient's wristband. Identifying patient ensures the right patient to receive the intervention and help avoid errors or medical errors. Sir, ano yung pangalan, sir?
Lazo Rd Woundcare.
Imong birthday?
August 7, 1994.
Okay, thank you. Tama. Step 2. Reviews order for irrigation and type of solution to be used. To confirm that physician's order are appropriate to wound assessment. Okay, so we have here a doctor's order to do wound care using normal saline solution. Step 3. Assess patient's level of comfort and offers analgesic at least 30 minutes before removal to promote patient's comfort during the dressing change. Sir, kamusta yung gibati karon, sir? Kamusta yung paminaw?
Feeling better.
Okay. So, kamusta po di mo wound, sir?
It's better, but when I move it stings.
Nagangot-ngot gihapon?
Yes.
Okay. So, nakoy hatag karon sa imong natambal. Ang tawag is analgesic. So, makatabang ni siya para during procedure or wound care, dili sakit. Kaya kung wala man gud ni siya, sakit siya. Tapos, lisod siya pag wala gud ni.
Okay.
Step 4. Reviews medical records for symptoms related to patient's open wound to determine the cause of the wound and may provide important insights into why the wound isn't healing. Reviewing medical records of the symptoms of the patient's wound. We have here patients experiencing pain. Pain scale is 2 out of 10 with a characteristics knowing pain. Step 5. Assess patients for history of allergies such as antiseptic, medications, tapes, or dressing material to ensure there aren't medical risks that will predispose to a medical emergency during the procedure. Sir, another question. Allergic ka mga latex gloves or tapes, dressing, or gauze?
Not that I know of, no.
Okay. So, wala dyan kay allergic baskin isaan to pag i-apply?
No.
Thank you. Step 1. Identify expected outcomes. To be able to know possible outcomes during and after the procedure. Step 2. Administer analgesic 30 to 45 minutes before the procedure if needed to promote patient comfort during the procedure. Sir, maghatag na ko para ng tambal, sir, ha? Para dili kayo sakit pag maglimpyo na ko sa imong sakit.
Okay.
Step 3. Educates the patient and family about the procedure to gain knowledge and facilitates cooperation. Okay, so sir, kabalo na ka sa akong himuon?
No.
Okay, so i-explain lang na ko. So, sir, what we're going to do is we're going to remove the old dressing, then clean your wound, then irrigate. So, meaning, ato siyang pagasan og solution para matanggal mga nana or exudate, then ato siyang i-dry or paugahon. Then, after ana, tabunan na po nato siya og bagong dressing or new dressing para limpyo and paspas ang process sa healing.
Okay.
Step 4. Gathers appropriate supplies. Preparation promotes efficient time management and organized approach to the task. So we have to gather equipment necessary. So we have here the normal saline solution, the kidney basin, but if you don't have any kidney basin, you can use plastic container. We also have syringe with angiocatheter, then cotton buds for getting specimen, waterproof underpad, biohazard bag, our dressings, but if you don't have any dressing, you can use wipes or cotton bud or bond paper. We have pen here for documenting our dressing. Then we also have bandage tape, and we also have PPE composing face shields, gloves, mask, then our gown, or you can use apron. So we also have here disposable tape for measuring length and width of the wound, then forceps for cutting the dressing. So these are the equipments needed during the wound care procedure. Step 5. Close the curtains or shut the door, performs hand hygiene, and position the patient appropriately to provide comfort and privacy, to deter the spread of microorganisms, and to provide easy access to the wound. So sir, saralan ako ang door o ang curtains sir hapalal. Wala yung makakita sa imo hawal nagabuhat ka sa wound care or sa procedure.
Okay.
By the way, sir, comfortable na kasi mo position
Oh,
or
yes.
kailangan pa i-adjust?
It's okay.
Thank you. Step 1. Performs hand hygiene to deter the spread of microorganisms. Sir, magsugod sa akong hand washing ha before ta magsugod. Step 2. Form scuff on biohazard bag and places near bed. Having water container handy means the sole dressing may be discarded easily without the spread of microorganisms. Step 3. Applies PPE or personal protective equipment, uses sterile technique or sterile precaution if needed, discards old dressing and gloves, then perform hand hygiene. This is all done for safety precautions and to deter the spread of microorganisms. Step 4. Applies clean gloves and performs wound assessment to prevent cross-contamination between the patient and healthcare provider. Also, when assessing wound, you have to watch for COCA, which are the color, odor, consistency, and amount of drainage. Wear your clean gloves. Sir, sakit pa, sir?
No.
Okay, so to assess wound, begin by noting its anatomic location. Then, Using measuring guide, measure the length, longest point of the wound, width from side to side, and depth by inserting a cotton tip applicator into its deepest. Also assess for color, consistency, odor, and amount, how much dressing is saturated or drainage. Step 5. Exposes area near wound only. This allows to preserve the dignity of the patient and also to provide privacy and comfort. So first, we have to remove the old dressing by peeling up the adhesive to the skin by gently tugging it. Sakit, sir.
Ano?
After that, you have to assess the dressing. So we have here a slight bleeding from the wound. Then dispose the old dressing properly into the biohazard bag. And remove your old gloves. To prevent contamination. Step 6. Irrigates wound with wide opening. Fills the syringe with irrigation solution. There are different kinds of irrigation solutions. These are the normal saline, lactated ringer, and antibiotic solution. So sir, position na to atong kamot. Then dapat kanila ang naka-expose, then ang lawas nakatabon. Then i-insert na ko ni sa ilalom para dili mabasa imong bed inig irrigation nato. Then kani ang kidney basin, butang nato siya sa kilid sa imong kamot para mao ni ang mosalod sa solution or liquid. Next, attaches 19 gauge and geocatheter. This is to provide proper amount of pressure during the irrigation. Sir, mag-irrigate ko karon sa imong wound ha para malimpyuhan imong mga nana-nana, tapos pasilitan nako siya og normal saline solution.
Okay.
Next, hold syringe tip above upper end of wound and over area being cleansed. In cleansing, you will apply irrigation from least contaminated to the most contaminated area. This prevents the spread of contamination of the wound site. Next is flush wound using continuous pressure until solution draining was clear. This is done to continuously irrigate the wound and removes exudates. Step 7. Irrigates deep wound with small opening. First, attaches soft catheter to filled syringe to facilitate access in the small opening for flushing of the wound. Next, insert tip of catheter into opening. Then flushes wound using slow continuous pressure. This prevents flashing of irrigation solution. Next, pitches of catheter below syringe while in place. This helps secure catheter in place while irrigating. Next, removes and refills syringe, reconnects to catheter, repeats until solution draining is clear. To ensure that unwanted material like pus or exudates from the wound has been cleansed off. Step 8. Applies clean gloves and cleanses wound with handheld shower. Applies clean gloves, adjust spray with patient seated, and ensured water was warm. You have to ensure that the patient is seated in order to prevent slips and fall, and make sure that water is warm to facilitate proper irrigation and removal of exudates. Sir, paki-check daw ko, sir, if okay ra ang kainit.
That's okay.
Next, shower the wound for 5 to 10 minutes. This allows adequate time to cleanse and irrigate the wound. Step 9. Obtains cultures after cleansing with non-bacteriostatic saline when indicated. This provides sample for the lab for further analysis. Sir, karon magkuha ko gamay na sample sa imong samad para ipadala niyo siya sa laboratory for further assessment kung naabay infection or paayuhay na ba imong samad.
Alright.
Step 10. Dries wound edges with gauze and dries the patient to reduce moisture and to prevent further bacterial growth. Step 11. Applies appropriate dressing, labels with time, date, and student nurses' initials to provide proper documentation and accountability. Karon humanatag limpyo sa imong samad or wound, mag-apply na ko bagong dressing which is kani. I-apply na ko siya karon, sir, ha.
Okay.
Pwede ko pahawid din banda, sir. Thank you. So karon na humanan ako siya dressing, magsulat na ko sa akong initials o date na akong gitaon. Tapos ang oras ko. Sulat na ko ang oras karon.
Okay.
So, then date karon. Akong initials. Step 12. Removes mask, goggles, and gown to dispose contaminated PPEs and to deter the spread of microorganisms. Step 13. Disposes equipments and soiled supplies, removes gloves, and performs hand hygiene, again to deter the spread of microorganisms.
Sir, excuse me, remove na ako insert na.
Sure.
Step 1. Have patient rate level of comfort to promote patient satisfaction and determine the level of comfort. Also, to identify areas of improvement.
Hello, sir. So, kamusta naman? Nagangot-gut pa imong samad, sir, or okay na?
No more. Okay na siya.
So, feeling comfortable na kasi mong dibati karon?
Yes.
Step 2. Monitors type of tissue in wound bed to determine whether or not the wound prognosis is good.
Based sa atong gibuhat ganina na nagalimpyo ta sa imuhang wound, natay ginatawag na epithelial tissue or nagaingon nga paayuhay na imo samad. So, mga pilarang kasi man na maayo na siya.
Okay.
Step 3. Inspect dressing once every shift or as ordered to obtain up-to-date assessment data.
Sir, mag-inspect ko balik sa imuhang wound dressing. Paghapit na mahuman akong shift, then tanawon na to if nagapuno na sad ang dugo sa imong dressing or kailangan na basat siya lisdan or depende sa doktor kung gusto niya tanawon ang imong samad every 4 hours. So, every 4 hours po na to siya i-check.
Okay.
Step 4. Evaluates peri-wound skin integrity to assess the surrounding of the wound, because frequent application and removal of adhesives can cause damage to the surrounding tissue or skin of the wound.
Tanawon po na to ang kilit sa imong samad kung naabay damage. Pero so far wala man kay kadalasan man good, sir, pag naisamad sa kilit kay tungod na siya sa tape na sige katanggal. So far wala man, sir, and okay man ang imong kamot.
Step 5. Observe for presence of retained irrigant to ensure that all irrigants are removed and dried off, and also to prevent skin irritation.
Sir, i-check po na ko ang imong mga kilig-kilig kung napay nabili na irrigant solution or mga basa-basa. Pero so far, wala man ko'y nakita. Kay kung naamang good, so naay possibility na magka-irritate imong skin. Pero so far, wala man.
Step 1. Records procedure performed and all findings in the patient's chart to have accurate documentation and implementation that you have done.
Record procedure performed, wound care done around 12 a.m. Findings, we have that shows epithelial tissue. So, wound healing is present, then no complaints of pain.
Step 2. Reports to healthcare provider any evidence of fresh bleeding, sharp increase in pain, retention of irrigant, or signs of shock immediately. This is important to be able to provide continuity of care for the patient.
So, sir, kamusta naman? Nagamot-mot pa yung samad?
Ano?
Kung nakay problema or nakay needs, tawagan lang ko, sir, para ma-refer ka sa doctor for further check up or further assessment sa inyong sunod.
Okay.